Good evening, everyone. We have a special message. Oh, good evening, everyone. We have a special message for you from kids of CCSF employees. Next slide.
If you take a flu shot, you won't get sick.
If I give it to my family, then they could give it to other people and a bunch of people could get sick.
You get a lollipop after? I'm being really bossy to you because you have to do it.
Aren't we dealing with enough of COVID-19?
If Mom has the flu, she can't go to work and make money.
You have to suck it up and do it because it will only hurt for a second.
It only hurts a tiny hint.
They put superheroes in your arms to help you get better, sort of, you know? 1, 2, 3, boom, you're done.
They do something to help the I don't know. You will get your flu shot. If you don't have it, well, something bad could happen. You have to go get your flu shot or else. Don't be scared, just get it and be brave.
Yes, everyone, please be brave this flu season and get your flu shot. So I want to welcome everyone. Good evening. Thank you for joining us at 5:30 for our SFHSS Dental Vision FSA and Deferred Comp Virtual Health Fair. My name is Jessica Shi. I'm the new Communications Director at SFHSS. We have a jam-packed agenda today with everything but health plans or voluntary benefits. We actually had a voluntary benefits webinar earlier today, and we have one more coming up, so don't worry if you missed it. So while we are all still living under a certain level of shelter in place, it is, and I've been talking to many of the presenters here, it is mostly, safe to go see your dentist and your eye doctor, get your preventative care exams, and they're going to tell you about how you can access care. Just call and schedule an appointment and ask questions to see if you feel comfortable with your dental or your eye doctor's office and their health and safety practices. We live in a time where we definitely want to take extra precautions, but please don't hold off on taking care of your health. If you go to the next slide, please, Anthony. Great, thank you. So today is all about your health. All of our plans will be highlighting different ways you can access care during this time. We want you to be super well informed while you're making your benefit elections. And so just a few ground rules for today. Everyone will be on mute during the presentation, but you can still talk to us and ask us questions. So all you have to do is scroll onto your screen right now, and the menu bar, depending on whether you're joining via mobile or your computer, may either be at the top or bottom of the screen. But once you find your menu bar, you're going to find that little question mark box, and that's how you can talk to us. So you open the question mark box, and it's going to be like a live Q&A chat box, and you can ask us questions throughout this entire webinar. And at the end of the webinar, we're going to have a Q&A session with all of our vendors here. That's why we invited them. And, oops, sorry, if you can go back. Perfect, thank you so much. If we aren't able to get to all of the questions today, we will have them posted within a week on our website at sfhss.org/OE2021. Oh, sorry, it's a dash FAQ. I apologize for that. Next slide. So this is today's agenda. We're going to kick off with Mitchell Griggs, who's going to talk about what's new with your benefits. Then Carrie Bashirs is going to share the awesome well-being programs that she's working on. Sharon Stanek-Lowe will be talking about Delta Dental's program. And Iris Schaefer will be sharing United Healthcare's dental HMO plan. And then Rick Neward is going to talk about flexible spending accounts. With PNA Group, we've actually already gotten a lot of calls regarding FSA. So if you have questions, please feel free to ask them. Matthew Smith, he's going to talk to you about your retirement and deferred compensation. And then Jennifer Carlson will be sharing the Vision Service Plan. And finally, we're going to share our SFHSS service hours and have a Q&A. Next slide. Great. And now I'd like to introduce Mitchell Griggs, our Chief Operating Officer, who's going to talk about our open enrollment updates. Mitchell, are you on mute?
Yes, I was. Thank you. I'm Mitchell Griggs with the San Francisco Health Service System, and I wanted to thank everyone for participating in our our first open enrollment that we are providing virtual health fairs and virtual member services. Next slide, please. Our member services has been, our offices have been closed actually since mid-March, as soon as the shelter-in-place health order went into effect, and our benefits analysts have been answering questions by phone. So I want to make sure that everyone realizes that our website is a great first stop for answering all of your questions. We've done a lot of work on that website since the past year or so, and every opportunity to get, we improve it. But if you cannot find your answer on HSS, please do give us a call. We answer eligibility enrollment telephone questions. We help you navigate your benefits when you have questions about, you know, what if I do about this situation or that situation as far as covered benefits are concerned. And then we can help you access your benefits. Sometimes there's these nice little benefits within your health plans or dental plans, et cetera, that you may not be aware of. So we like to make sure that everyone is aware of all of their benefits that they have. And our member services hours currently are 9 a.m. to 12 p.m. and 1 p.m. to 5 p.m. except for Thursdays. Thursdays it's 10 a.m. to 12 p.m. and 1 p.m. to 5 p.m. So next slide. So speaking about the website, we did a lot of work this year on improving our open enrollment website. We conducted some surveys with our members when they would call in. We asked them if they would have a few minutes. But we got their feedback and their experiences with our website. So I think people will find it improved over the last years. We've also sent everyone in the mail an open enrollment packet, which includes a open enrollment letter with your specific information on it, enrollment and your costs. Everyone needs to look at that and read the information and double check that everything that you have, your dependents, are accurate. It's the way that you want it to be for 2021. Within that packet is a step-by-step instruction within the booklet, and everyone on this call should have gotten one of these booklets based on your employer. You know, dark blue, red, a baby blue, or green booklet, and on the front cover is a step-by-step guide on making benefit decisions during open enrollment. And everyone who works for the city or San Francisco Unified School District or Superior Court do have access to e-benefits. That means you can go and enroll and do this online through the employee portal. Similar to your open enrollment letter, you can go in there and see who your dependents are, how much your costs are, how much your costs are going to be for the following year, as well as you can start calculating costs if you decide to change your plan. We do have paper enrollment forms available. And people prefer to do that instead of online. They can be downloaded from the website, printed and completed, faxed to us, sent to the U.S. mail, or dropped off here. We have a bin down in the lobby next to the security desk in our building at 1145 Market, so you can certainly drop them off there. Next slide. We also have what I consider very far-reaching e-news for everyone, employees and retirees, all the employers. I think it's a really good resource for you to always stay up to date on your benefits or changes. You know, either within our agency or within benefits, we highlight certain aspects of benefits that you may not be aware of. and also all of our well-being information is in there. And we put a lot of effort into this, our programs, our well-being programs, and our communications materials and this e-news. So I highly recommend that if you haven't already, to sign up for our e-news. You can go to our website at sfhss.org and sign up for e-news at the bottom of the page. The e-news comes out once a month, pretty much like clockwork in the first week of the month. A few things that are new for 2021, we're going to go through a lot of those. FSAs are dental and our vision plans, but just as a reminder, just double check your rates for next year and make sure that you are aware of what your premiums are going to be. They did go up some this year, so you definitely want to check that out. Also, we have a couple of enhanced voluntary benefits. As Jessica mentioned earlier, we did have a one voluntary benefits webinar, and we will have another one in the future. On October 21st, it looks like. And these are benefits that, you know, supplemental life insurance, additional life insurance. Some of us get $50,000 of life insurance from the employer or less. And if you think you need more, you can purchase that supplementary or supplemental life benefit. There's also things like pet insurance, accident insurance, etc. This year, we're offering 2 new benefits for MetLife. One of them is a critical illness, which has very good rates. I suggest you check that out. We also have an accident insurance that MetLife is offering for 2021. An additional new benefit is identity theft protection from Allstate. This is a great benefit, and it's better than the ones we've offered in the past because it also does social media monitoring for you or a family member. So do check out your open enrollment materials. A lot of this information is in there, you know, and you're going to certainly hear a lot about what's new with FSAs, the dental plan, and vision in this webinar. So thank you very much.
Thank you, Mitchell. And now I'd like to introduce Carrie Bashirs, the Wellbeing Manager, who's going to talk about our great wellbeing programs that are coming up.
Hi, good evening, everybody. Carrie Bashirs with SMILEWAY. So I'd like to definitely introduce to you, hopefully some things new, some things not so new, but just some good reminders about some of the wellbeing offerings that we have to support you. Next slide. So today is a day, these are the times in which, you know, mental health support is much needed. We are really trying to emphasize and push self-care. And so I wanted to highlight some of our emotional and mental well-being services that are available to you. So back in April, we were able to expand our EAP services to 24/7. So what that means is if you call outside of business hours, you will actually get connected with a behavioral health specialist that will be able to in turn connect you with a licensed clinician to help you with any of your mental health needs that you'd be looking for. We continue to have our internal EAP team, so they do as well. They serve all of our employees, active employees. And in addition to that, they do provide some organizational services. Those include management consultations, workshops and trainings, critical incident response and debriefings, mediations and de-escalation trainings. So when in doubt, if there's something even going on within your organization, if you've incurred some sort of a critical incident outside of, you know, COVID, because COVID is what I would call a long-term critical incident, our team is there to help support you. And even in today's day, they also have started to expand their services and doing small groups. And we found that the small groups were really getting a lot of folks who have been joining to talk through kind of their concerns or the work that they're doing to help support the COVID response. In addition to that, we have some online resources. In May, we focused on Mental Health Awareness Month and created a dedicated webpage called We're Here For You. where you can find some additional mental health resources. And then when COVID hit, that meaning back when we went to shelter in place, our Wellbeing team also created a COVID-19 Wellbeing resource page. One of the other things that we're really excited about doing and adding to our services is a product called Credible Mind. Credible Mind is a web platform that houses a ton of different resources in relationship to mental health, self-care, and well-being. Those might be things like, you know, if I'm interested in searching things around stress or anxiety, I can go onto that website, I can search to see what types of resources are out there, and I might be interested in blogs, so I can look at certain blogs that are within those topic areas. So you'll hear more from us coming soon once we're launching that web platform. Next page. One of the other things that we've been able to do is move a lot of our well-being services virtually. So we encourage you to check out online. We've got health education webinars, group exercise classes that are all being offered virtually. Some are on demand, some are live. In addition to that, we've moved the diabetes prevention program and healthy weight program also to a virtual platform. As of right now, the new cohorts for diabetes prevention and healthy weight will be starting in the new year. So again, take a look at our website for more information coming out soon. And then some flu clinics. We have worksite flu clinics that are happening basically through about second week of November. So check them out. If you can't get to a worksite flu clinic, we encourage you to go through your healthcare provider to get vaccinated this year. There's a lot of ways that you can do that and do it easily. My whole family jumped in our car together, rolled down our four windows, and got our flu shot. So it was really simple. And then again, we do have some additional online resources, which I already mentioned, that are supporting around your mental health and well-being. Next slide. I'm not sure if there's a next slide.
The last slide was one.
Yeah, we might have skipped one. That's all right. I can speak to it. Oh, there we go. Perfect. So this year we are launching a 4-week challenge that focuses on mindfulness, gratitude, connection, and optimism. These are all things right now, perfect timing. We need that. We need to focus on being more mindful about taking self-care and really connecting with others. And so we're launching a 4-week challenge starting November 9th through December 6th. Registration will start the 26th of this month. So we highly encourage you to join, challenge yourself, pull in your family members, some of your team members to engage, and it'll really help to focus on how you can enhance your skills to boost happiness and resiliency. Next slide. For more information, you can visit our website at sfhss.org/WELL-BEING. Thank you, and I'll turn it back over to you, Jessica.
Thank you so much, Carrie. And yes, lots of new programs are happening all the time, so that's a great website to just save and bookmark on your browser. So now I'd like to introduce Sharon Stanek-Lowe, our National Account Manager with Delta Dental.
Hello, everyone. Good evening. I am here to present your healthy smile and how to keep those pearly whites white and without decay. Next slide, please. All right, and we can go on to the next slide as well. Why is it important to get a dental exam? Well, it can identify dental problems early. You'll receive a cancer screening, an oral cancer screening from your dentist. And it's also an opportunity for your dentist to catch any signs or symptoms of other diseases, such as kidney disease or acid reflux. All of these can be detected through your mouth. And a lot of that is detected by inflammation of the gums and other signs that your dentist is looking for. Next slide, please. A healthy mouth actually does create and help you maintain a healthy body. By taking care of your teeth and gums, it actually does improve your overall wellness, versus poor oral health may worsen diabetes, rheumatoid arthritis, heart disease and stroke, and dementia. Next slide, please. Investing in preventative care, such as having that regular dental visit, can actually save you money. You'll pay little or nothing for a cleaning and exams. By seeing your dentist regularly, as we mentioned in the earlier slide, they can identify those problems early and thus prevent those costly dental treatments. Next slide, please. Your coverage under the PPO plan and the DeltaCare DHMO plan for cleanings are demonstrated on the slide. You, under the PPO plan, would receive or could receive 2 cleanings in a benefit year. That would be 100% covered if you sought services from either a PPO or premier dentist, and 80% of the program allowance coverage for non-Delta dental dentists. And what's critical here is always to ask every dentist takes Delta dental, but the next question or the follow-up question of your dentist should be, are you a Delta dental PPO or premier dentist? And that is the 2 contracted dentists with our organization, and you'll get definitely the most bang for your buck. As far as DeltaCare USA, the DHMO plan, also you can receive 1 cleaning per 6-month period, and there's no copayment, so there's no cost to have a cleaning under the DHMO plan. Next slide, please. Here's an example of a decayed tooth, and if we look at the left-hand side where we show a filling, that out-of-pocket cost could be around $33. And then if we go all the way to the end, to the right-hand side, the extreme decayed tooth would require a dental implant, and that can cost over $2,500, which would exceed your calendar year maximum or annual maximum. Whereas, as you can see, with a healthy tooth, you pay 0. Next slide, please. So for oral exams, typically an oral exam is in conjunction with a cleaning, although those oral exams can be separate from a cleaning. If under the PPO plan, you should at least receive 1 exam a year, but if you needed more, you actually have coverage for 2 oral exams in a benefit plan year, and that would be January through December of each year, and they're covered at 100%. Again, if you're seeking services from a non-Delta dental dentist, that would be an 80% coverage benefit, and also 2 exams in a benefit year. And then there's no copayment for the DeltaCare DHMO or DeltaCare USA plan. And you can receive as many oral exams as you would like under that plan. Next slide, please. Kids are definitely at risk for decay, dental decay, and there was a study done. Here is just some demonstration of the statistics that were found in different levels of as a child ages. So the first tier would be under 3, the second is 3 to 18, and then kids over 18. For infants, the first dental appointment should be done after they reach 1 year of age, just as an FYI. Under your PPO plan and the Delta Care plan, you actually do have orthodontic coverage. That is 50% of a cost share, so we would cover 50% up to a lifetime maximum of $2,500 for the if you sought services from a PPO dentist, $2,000 for a premier dentist, and $1,500 for a non-Delta dental dentist. This lifetime maximum is separate from your annual maximum of $2,500 that you receive and is replenished every single year. Whereas the orthodontic lifetime, that's why they say lifetime in front of it, that's just a one-time, once you exceed the $2,500, there's no future orthodontic benefit. Under the Delta Care plan, it's a $1,600 copay for comprehensive treatment. With the Delta Care plan, hopefully you're familiar with the difference between PPO and DHMO. Under the DHMO or Delta Care USA plan, many of the services that, such as crowns, orthodontic, are a co-payment. And as you saw from the previous slides, the preventative, cleanings, exams, those routine preventative services are all at no co-payment, so no cost or out of pocket to you. Next slide, please. Boosting your benefits. So this is a plan, actually, if you're enrolled in the Delta Dental PPO plan, this is for the Delta Dental PPO plan. If you're in the Delta Care plan, this plan would not, you would not be eligible for it. But it is added coverage, dental coverage, if you have been diagnosed or currently have heart disease, stroke, rheumatoid arthritis, diabetes, HIV, or AIDS. You would need to opt in to the SMILEWAY Wellness benefit by either calling our contact center at the phone number on the screen, 888-335-8227, or you can enroll in this plan, opt into the SMILEWAY Wellness plan, which is on top or would be in addition to your PPO dental plan. And you can go through your online account and enroll in this plan online. By enrolling in this plan, what it affords you is 100% coverage for one scaling or root planing procedure per quadrant per year, and any combo of 4 of the following per year, which would be cleanings at 100% or gum maintenance covered at 100%. A little bit of a new item that's coming, enhancement to this benefit, coming January 1st of 2021, will be that the 100% scaling, root planing, or the cleanings or gum maintenance will not count toward your annual maximum. So that will be additional benefits that and will still allow you to have that $2,500, that pot of money, to use for other services. Next slide, please. Not to confuse the reference, but we also have a SMILEWAY Wellness site that's actually on your microsite, and you can find that. It's in the lower left-hand corner, but look for the little SMILEWAY logo with the little man holding up the plastic card. And on this site, you can receive or see 100 different articles on everything from acid reflux to x-rays. There's a dozen short videos if you like to learn that way. There's tooth-friendly recipes, there's a risk assessment tool, and there's quizzes. And there's some fun activities for children as well on this site. So both for adults and children, I highly recommend visiting. If you wanted to go to the site just through Delta Dental, just our main site, you would put in mysmileway.com, but you can also find that on the microsite, which, next slide, please, is on the screen here in the middle. Your microsite specific, all the content that is loaded on this microsite is specific to SFHSS, and that would be at deltadentaliins.com/CCSF. You can also call us by, if you're in the PPO plan, that 888-335-8227 number, or if you're enrolled in the Delta Care plan, it would be the 800-422-4234. Again, your benefit highlight sheet specific to your plan, what your dental plan covers, and any type of plan summaries, evidence of coverage booklets are all loaded on that site. Next slide. I want to thank you for your time, and I hope that you'll use the chat feature to ask me some additional questions.
Thank you so much, Sharon. If you can go to the next slide. Great. So now I'd like to introduce Iris Schaefer, the Field Account Manager with United Healthcare, here to share the dental HMO plan.
Hi, everyone. Thank you. Thank you for taking the time to join this webinar and learn more about your dental plan that United Healthcare and your employer are making available to eligible employees. This presentation will be a brief overview of that coverage. Next slide. Having a United Healthcare dental plan helps make it easier for you to take care of your teeth and gums. Good oral health not only gives you a healthier, more beautiful smile, it also plays a role in your overall health. Next slide. With this plan, you can save money and invest in a healthier smile to last a lifetime. Under the plan, there is a network of provider groups who have agreed to offer specific services at negotiated rates to United Healthcare members. Each family member has the flexibility to visit the dentist of their choice in our network. The member needs to visit a primary care dentist from the regional network available in their area. Your primary care dentist will coordinate your dental care needs, including referrals to specialists if that's needed. And there's no waiting period for the services under this plan. Next slide. To get dental coverage, you must be an eligible employee with the City and County of San Francisco, eligible employee or retiree. If you purchase coverage for yourself, dependent coverage is also available. Next slide. This is a simple, lower cost plan that covers a range of dental services. You can see any general dentist in our network that you want. If you choose to see a dentist that is not in our network, you will not receive coverage. So it's really important to stay in the network. You may also see this plan referred to as a direct compensation plan. Next slide. With this plan, it's your choice when it comes to dental care. The first step is to choose a primary care dentist, and each family member can choose a different dentist that they like. You don't need to contact United Healthcare in order to select a dentist. You can choose any general dentist that's in our network. When you choose your dentist, just show your ID card and you'll have the advantage of our negotiated rates. You'll be responsible for the office visit copay and specific copay amount for each covered service based on your plan design. And your provider will even submit the claims for you. Next slide. Your dental member website, myuhc.com, offers information and easy to use tools to help you get the most out of your dental plan. You can find a network provider in your area, view plan information, and find answers to commonly asked questions. And you can even download and print an ID card. Next slide. Thanks for taking the time to listen and learn about your dental options through United Healthcare and your employer. To review plan materials, they can be found on welcome-to-uhc.com/SFHSS. Thanks again for your time.
Thank you so much, Iris. And now, who I think might possibly be the most popular presenter today, Rick Newer, the National Broker Coordinator for P&A Admin Group, is going to share information about our FSA program. And thank you, Rick, for answering all those questions.
Of course, thank you, Jessica. Good evening, everyone. My name is Rick Neward with the P&A Group. We are the company that administers the flexible spending accounts for the city and county of San Francisco. As Jessica indicated, there have been quite a few questions coming in. And before I even get into the slides, which might not address some of the pressing questions that you have, I do want to spend a real quick minute on addressing some of the COVID relief and what options are available to you if you're currently a participant in the flexible spending accounts. The first one is the Health FSA. We are receiving a lot of questions on how the carryover works because many of you maybe have funds that you were not able to spend this year because some of your planned expenditures didn't happen as a result of COVID. You can carry over up to $550 from 2020 to the new plan year in 2021. One thing to note though, if you have carryover funds from 2019, it is important that you spend those before the end of this calendar year. All right, because carryover funds are only available in the subsequent plan year. They do not carry over to over multiple plan years. All right, so just to be clear, if you have 2019 carryover money, make sure you spend that before the end of this year. If you have up to $550 remaining from 2020, that will carry over into 2021. Now that only applies to the Health FSA. And a lot of the questions that we've been receiving from customers all over the country is, I've got dependent care contributions that are sitting there that I don't think I'll be able to use prior to the end of the year. Unfortunately, with this account, the IRS does not permit any carryover of unused balances. All right, so again, it is very important that you spend those dollars before December 31st. All right. Unfortunately, and there's been a lot of back and forth, there is some legislation that's part of some of the relief negotiations that does include provisions that would allow for refunds of dependent care dollars and even Health FSA dollars. But as it stands today, that is not in place, and it may not be part of any final bill that they have. Okay, so I just wanted to address that real quickly. Then we can get to the next slide, please. So for those of you that are not familiar with flexible spending accounts, you need to determine how much money you want to set aside into your flexible spending account. And you do this by estimating your predictable expenses for the upcoming year. As I already touched on, there are two different accounts that you can participate in. We'll get into the details of those, but you want to be conservative when enrolling in a flexible spending account. This is not an insurance plan. You want to use it for predictable expenses because you don't want to be stuck at the end of the year with a large balance that you're unable to use. When you enroll in the FSA during the open enrollment period, which is now through the end of October, and your benefit will be effective on January 1st, 2021. Whatever amount you elect will be divided evenly and deducted over 25 paychecks. Next slide. Here's an example of somebody that has estimated their annual expenses to be $780. Your biweekly payroll is 25 pays. The amount deducted would be $31.20 that goes into your Health FSA, and that goes in on a pre-tax basis. So the benefit to you is that you are able to use pre-tax dollars to pay for expenses that you would normally pay with after-tax dollars. Next slide, please. As I mentioned, there are two different accounts that you can elect to participate in. The Health FSA, which is used to cover the cost of medical, dental, and vision expenses for you and your eligible dependents. So when you're estimating your annual cost, what you may want to elect for the Health FSA, it's not just for your expenses, it's also for your eligible dependents as well. The second account is the Dependent Care FSA, and this is to be used for expenses you pay for daycare centers, babysitters, after-school programs, day camp programs, and even elder care facilities or in-home care for an elderly parent that you claim as a dependent on your tax return. One special note on dependent care, we've gotten the question quite a bit about virtual camps. And the IRS has a test to see if something qualifies as a dependent care expense. And the test is, do they require supervision while performing that task or at that care? All right, so if the children are still at home with you and they're attending a virtual camp, unfortunately, the IRS test says that that is not a qualified daycare expense because you still need to be present and supervising the child during that activity. All right, so we've had that question quite a bit in the age of COVID. Next slide, please. Some rules you need to keep in mind. One, in the Health FSA, your full annual election, and we actually had this question come up, your full annual election is available to you on the first day of the plan year. So if you're going to enroll for the upcoming plan year 2021, you can elect up to $2,750. And if you elected that maximum on January 1st, that's what you have access to. So a lot of people use these plans and they budget for big expenses like LASIK eye surgery or orthodontia expenses. You don't have to wait until the money's been payroll deducted. It is available to you on the first day of the year. Okay. Now, you are only allowed to change your election if you experience a change in status, marriage, birth, death, the typical qualifying events that you're used to. Those would be the only exceptions that would allow you to change your election during the year. Beyond those, you are committing for a full year, and you couldn't change your election if you didn't have a qualifying event. And again, as we already talked about with the rollover, unused funds between $10 and $550 will roll over into the next plan year. So keep that in mind when you're estimating your 2021 expenses. If you have rollover funds, those will be added in addition to your new plan year election. Next slide. Some sample expenses that are eligible for reimbursement underneath the Health FSA: copays, deductibles, prescription, dental work, that includes orthodontia, as I mentioned earlier, eyeglasses, including prescription sunglasses, contacts, saline solution, and new, and this is part of the CARES Act, over-the-counter medications no longer require a prescription or letter of medical necessity. So for those of you that maybe have used flexible spending accounts for many years, you remember in the old days, you were able to buy Advil and cough drops and Robitussin, all those over-the-counter items, and be reimbursed from your FSA. That changed, and now it's gone back. So it's more easy for you to spend your money now that you can purchase these over-the-counter items. And they even expanded the list to include feminine care products. So if you are in the program currently and you're trying to figure out some ways to clean out your 2020 FSA balance, you can purchase over-the-counter medications, okay, and help you spend down that balance. Next slide. To help you spend that money, we also have a partner that we've been working with for many years, the FSA store. The FSA store is accessible through your account at our website. So it's a convenient way for you to go and order over-the-counter items. Pricing is competitive, and everything sold on this site is eligible. So you never need to give us any receipt. We know everything you're purchasing is an eligible expense. It will automatically be approved. Next slide. The dependent care account, a little bit different than the Health FSA, in that this is a pay-as-you-go account. And what I mean by that is, as the money is payroll deducted from your paycheck, it gets credited to your dependent care account and then becomes available for reimbursement. So if you're like me with children in daycare and you prepay your daycare provider, I turn my bill in the beginning of the month, but I don't get a reimbursement right away because I don't have the funds physically sitting in the account. As my employer takes money from my paycheck for my dependent care account, it automatically triggers a reimbursement to me, paying off that claim that I submitted. So unlike the Health FSA, you don't have access to the money in the beginning of the year. You do get access as it's payroll deducted from your account. Keep in mind, again, you can only change your election if you have a change in status. Now, I do want to touch on, there are some more relaxed rules when it comes to when you can sign up for dependent care. All right, right now, there's a lot of uncertainty with daycares and even preschools and after-school programs. If you don't know if you're going to have access to that care, those programs, you do not need to make an election at this time. You are able to enroll in dependent care when the need or the cost change. All right. So if in March your daycare opens up, that would be a change in the need or availability or the cost, and that would be a trigger for you to make your election at that time. Right. So if you're unsure, I encourage you to wait. All right. You do have the ability to get into the plan later if those options become available to you. Now, if you sign up though at open enrollment and you don't have any status or qualifying event changes, right, you are locked in for the year, so you're not able to change it later. So please keep that in mind. The contribution limit for this account is $5,000 annually per household. Unless you're married filing individual returns, then your limit is $2,500 for the year. Next slide. Some sample expenses that are eligible for reimbursement from the dependent care, as I said, after school programs, caregivers for a disabled spouse or elderly parent, daycare centers, day camps. It's important to note that overnight camps, while I doubt many of those are happening right now, but those are not allowed. The overnight portion is not considered daycare. Elder care and nursery schools. Tuition is not an eligible expense. So if you send your kids to private school, even if they're under the age of 13 and you pay for that private school, if it's kindergarten or above, that's considered tuition and not a daycare expense. If you have a babysitter come into the house and you're paying them with cash, you can be reimbursed for that as long as they're not an immediate family member and as long as they are claiming that income as income on their tax return. So one of the things that is required in order to be reimbursed from dependent care is documentation. We need to know who you're paying and we need their tax ID or social security number in the case of an individual. Next slide. Your debit card, for anybody that enrolls in the FSA, you will automatically receive a debit card in the mail that's issued in your name. The card will be activated immediately upon first use, although keep in mind it will not be activated until January 1st when the plan goes effective. If you're currently enrolled in the plan, the cards are good for 3 years. So if you have a debit card in your possession, take a look at the card. And if it's going to expire this year, you don't need to do anything. We will automatically issue you a new card. If you want to get additional debit cards for your spouse or dependents, you can also request those through your online account at www.padmin.com. Next slide. P&A has a mobile app, so if you ever need to submit documentation or you want to submit a manual claim, it's an easy way to submit that to us. It's available through the App Store. We also have a great feature on there called Easy Scan. That gives you the ability, if you're at Walmart, you're at Target, and you're not sure if something is eligible underneath the Health FSA, it actually allows you to use your camera, scan the barcode, and it will tell you whether that's an approved item. So it's a great way to find out what's eligible. Next slide. Our customer service, we're open Monday through Friday, 5:30 a.m. to 7 o'clock p.m. Pacific time. We also offer live chat during those same hours if you prefer to instant message with customer service, and our toll-free phone number is located here as well. Next slide. Thank you.
Great, thank you so much, Rick. And again, please feel free, anyone participating on this call, to continue to ask questions via our Q&A chat. Now I'd like to introduce Matthew Smith, our Voya retirement counselor, who's going to share information on our deferred compensation plan.
All right, so thanks folks for attending the meeting today. Yeah, again, my name is Matthew Smith. I am with Voya Financial, and we support the 457B retirement plan with the city and county of San Francisco. Go ahead and go on to the next slide there. There's actually 5 counselors that support city employees, and my main 2 divisions happen to be Fire and Department of Public Health. My colleague Tony Chu, he happens to cover HSS there at 1145 Market Street. And so we do encourage you to log on to sfdcp.org, and that's where you can schedule a meeting with your counselor, and we're happy to review your account or help you get enrolled. And so the first thing that you got to do is enroll into the plan. Again, you do that at sfdcp.org, and through the plan you can. Let's just take a quick step back. If you were to work for a company, then you might get what's called a 401k. If you were to work for a public school or a nonprofit, then you might get what's called a 403B. You folks work for the city, so you get what's called a 457B deferred comp plan. This is basically the 401k for city employees. Now, a lot of folks say, hey, what's the difference between the 457B deferred comp and my FERS pension? Well, with this FERS pension, you really don't make any decisions. It just kind of happens automatically. You don't choose how much you save. You don't choose how the money's invested. It just, like I say, happens automatically. Whereas with your 457B deferred comp plan, you need to make a lot of decisions. You need to choose how much you want to save, and if you want it to be traditional pre-tax or the new Roth after-tax, and you need to choose how you want to invest the money. It is my job as your Voya retirement counselor to help you with those decisions. And so, like I say, you have resources and you are invited to take advantage of them to help you make an educated choice regarding your 457B deferred comp benefits. The 457B is very flexible. You can increase, decrease, stop your contributions at any time, and you can also change your investments at any time. And so it's very, very flexible. Go ahead and go to the next slide, please. And so why save into the deferred comp plan? Well, like I say, if you work for the city, then you get your pension. And then a lot of folks, they also qualify for Social Security, which is great. But frankly, for a lot of folks, there is a gap, and you fill that gap with your deferred comp savings. And so that's a big reason why you do it. Go ahead and go on to the next slide, please. And so the next thing you got to decide is how much that you want to save. Go ahead and go to the next one, please. The next one that you got to choose is how much to save. And so I basically see three types of people. The first type of person, they want to max out. They say, hey, this is really important. I know I got to save. And the maximum, if you are younger than 50 years old, is $19,500. Okay. If you are over the age of 50, then you get what's called a catch-up, and you're allowed to save a total of $26,000. Now, if you've been with the city for a number of years and you have what's called an underutilized capacity, then you might qualify for special catch-up, which would allow you to save up to $39,000. If you are serious about taking advantage of the special catch-up, there's some paperwork that you're going to need to fill out. And so please contact your retirement counselor and we can help you with that paperwork. It is a bit of a process, but we're happy to help you with that. Okay. Now, lots of folks, sure, they would love to save $19,500, but they have to eat. So let's talk about some numbers that are a bit more realistic for a lot of folks. If you're going to take this seriously and really build your account and not depend on Social Security, your goal should be 10 to 15%. 10 to 15%. Now, that's not Matthew or Voya or the city or whatever. That's actually from the Department of Labor. You go to the Department of Labor website, guess what they recommend everybody say? Yep, 10 to 15%. And we tend to recommend a percentage more than a straight dollar amount. And that's because a percentage is going to follow your income. So as you get raises and promotions, and if your income changes, then a percentage is going to follow your income as compared to a straight dollar amount. And again, the goal, 10 to 15%, 10 to 50%. But I get it. You know, a lot of folks, you got tuition and daycare and rent and food and 3 boyfriends, and it's just not easy out there. Okay, so if things are tight, you start at 5, start at 3, that's fine. And then you can slowly bump it up. Go ahead and go to the next slide here. And so a nice feature available to you is that on the website, sfdcp.org, or by calling customer service, you can set up automatic increase where it'll slowly bump it up once a year or twice a year or however you want to do it. A really popular time to do the automatic increase is July. And that's because a lot of city employees, and this is not guaranteed, right? But a lot of city employees, they often get raises in July. So like I say, that's a popular time to do the automatic increase because it corresponds with when you maybe, might, could be, probably get a raise, okay? And so I like this chart here because it really shows the difference between maybe keeping it at 3% compared to slowly increasing it over time. And so if you can slowly bump it up, it will make a big, big impact over a long period of time. Go ahead and go to the next slide, please. And so the next decision that you need to make is if you want to save money in the traditional pre-tax format and or the new Roth after-tax format. And the good news is that you can do both. Okay, so quickly, the folks that tend to like the pre-tax money, they tend to be, as a trend, a little bit older. They tend to have a higher income. They say, hey, I'm making more money, which is great and all, but the tax man's loving me. What do I do? Well, you can hide that money from the IRS legally, for now, by doing the traditional pre-tax. Okay, so you get the pre-tax benefit, it grows tax deferred compounding. When you pay the taxes, when you take a distribution, you're going to defer that compensation to the future, and that's when you pay the taxes. But if you're in retirement, then in theory, you might be in a lower tax bracket during retirement than today during your working years. So the whole pre-tax thing works out well for a lot of folks, but not everybody. So now you have the new Roth after-tax 457. Okay, so it's a Roth provision within the 457B plan. So Roth is after-tax money. There's no tax break at the beginning. If you do $100, it's $100, no tax break. But the money's going to grow tax-free. And when you take a distribution, now you got to be over the age of 59 and a half, and the money has to be in the account for at least 5 years. But when you take that distribution, all the money is yours, totally tax-free, both what you put in and any potential growth. Okay, so who likes the Roth? Well, as a trend, they tend to be younger. They tend to have a lower income. They say, well, I don't make a lot of money, so I don't have to pay a lot of taxes, and they don't need the tax break as much today. So they're younger, they got this career ahead of them, they're going to be hopefully making more money in the future. And here's the key thing. If you think that you're going to be in a higher tax bracket in the future than you are today, then the Roth could be a good strategy. Good news, you can do both. You may think, all right, I want to save 10%. Well, you can do 5% pre-tax and 5% after-tax. Mix it up. I think that's a great strategy. Now, some people say, hey, can I do $19,500 pre-tax and $19,500 after-tax? Oh, I like the way you think. No, but that is a combined total. But hey, you can do $10,000 pre-tax and $9,500 Roth after-tax. That's okay. Now, another common question is, hey, I thought that I could only do $6,000, and I thought that if I make too much, then I'm not allowed to do it. Oh, see, that's with an IRA. A lot of people confuse this with an IRA. On an IRA, yes, you have those kind of restrictions. On your 457B, there's no restrictions like that. Okay, so you can make $1 million a year and still max out your 457B, no problem. Go ahead and go to the next slide, please. Okay. And so then let's talk a bit about how you want to invest your money. So God bless America. I mean, we got bonds and cash and stocks, and you get to choose how you want to invest your money. There are 13 core funds that are available. And some people like to create their own portfolio. And they say, hey, you know, go ahead and put me 10% to the large cap and 8% international and 16% small cap, and you got some bonds and a cash account. And like I say, some people like that. And you can create your own portfolio. But a lot of folks, they look at the list of funds and they say, great, so you got some large cap and small cap and a baseball cap, and I have no idea what's going on. So let's go ahead and go to the next page. And this talks about the really popular target date funds. And the target date funds on the next slide are very popular because they're easy. And they have a date, 2030, 2040, 2050. That date, that year, is when you are going to probably be about 65 years old and want to take your distributions. And the professionals will put you into a very well diversified portfolio of cash, bonds, and stocks appropriate for that length of time. When you're younger, you're going to see more exposure into the stock market, more volatility, more risk. But that's okay because you're younger and you can handle the volatility. As you get closer to the target date, the model will automatically adjust and become more conservative over time until you reach that target date where it's going to be much more conservative and ready for you to take your distributions. So again, the target date models are very popular because they're easy. You basically pick your target date and you déjalo en paz. You leave it alone. You let the professionals choose the allocation for you. Let's go ahead and go to the next slide. Now, another nice feature is that if you happen to have a qualifying event with SFRs, maybe you went on maternity leave or something like that, well, if you want, you can take some of the money out of deferred comp and buy back that time with SFRs. And it doesn't have to come from deferred comp. It can be from any old pre-tax IRAs or 401ks or 403bs. But like I say, if you want, you can potentially buy back that time with Spurs. If you want to do that, go ahead and contact the folks at Spurs, and they can help you with that. Okay. Let's go to the next slide, please. Now, if you're not currently enrolled, we highly recommend that you do that. And again, you enroll at sfdcp.org, San Francisco Deferred Comp Plan, sfdcp.org. And we see sometimes people, they enroll in the plan right before they're going to retire. Now, if they do that, it's usually because they have unused vacation hours. And I see people with 100, 200, 300 hours of unused vacation pay. Well, if you don't do anything, then the city's going to pay you out. And yeah, you're going to get a paycheck, but the IRS might love you also. Okay. So if you want, you can choose to defer those unused vacation hours into your deferred comp plan. Now if you want to do that, there is a form that you got to fill out, and you got to submit that to both your payroll and to SFDCP. If you want help with that, again, contact your counselor, and we can help you out with that form. Now, it's my understanding that it takes about 75 days after your last day of employment for those unused vacation hours to be deposited into the account. As a result, I sometimes see folks intentionally retire in November or December with the strategy that those unused vacation hours will be deposited after January 1st and come under the following year's cap. And so they say, hey, I've got, whatever, $20,000 of unused vacation hours. If you defer those after January 1st, then it comes under the following year's cap, and you'll be good to go. Okay. Go ahead and do the next slide, please. All right. So, hey, don't be shy. Talk to us. All right. If you go to sfdcp.org, you can identify who your counselor is, and you can book an appointment with us via a time tap. Where we can do a Zoom call or over the phone. Now, in normal times, we're out in the field, meeting with folks face to face, but that's not happening right now. So like I say, we do encourage you to book a one-on-one appointment with your counselor. We can help you get enrolled. If you're not enrolled, we can review the account for you. And that's all just part of the service. So don't be shy. Take advantage of that resource and contact your counselor. Go ahead and go to the next slide, please. And like I said, there's 5 counselors. Again, my name is Matthew Smith. I'm on the far right, and I happen to cover fire and Department of Public Health. My colleague, Tony Chu, he happens to cover HSS. And like I say, there's 5 of us. So don't be shy. Take advantage of this resource. Contact us. We are happy to review your account with you and just kind of make sure that you're doing the right thing. Hey, thanks a lot again for attending the meeting. And don't be shy. Give us a call. Thanks for attending.
Thank you so much, Matthew. And just to let you know, we do have a lot of questions regarding deferred comp on our Q&A. If you're able to access it, we appreciate you taking a look at that. So if you can go to the next slide, Anthony. Great. And now, and actually, I want to make a clarification. We actually have Nancy Jackson presenting information for our vision plan with VSP.
Hi, good evening, everyone. This is Nancy Jackson, and I'm here to provide you with an update on your VSP benefits. Next slide, please. So as you can see here, SFHSS does offer its members both a basic and premier plan. Some of the major differences are outlined and highlighted here. Under the frames, there's much higher allowances under the premier plan, as well as increased frequency. And this is the same for elective contact lenses as well. And then also under the Premier plan, you also have coverage for progressive lenses as well as anti-reflective lenses with a $25 copay. Under both plans, SFHSS does offer its members our primary eye care, which actually allows our members to go to their VSP provider for any medical vision conditions, such as pink eye, for a $5 copay. Next slide, please. So this here you'll see is just a sample out-of-pocket comparison of an actual SFHS's claim, comparing usual and customary out-of-pocket versus what a member would pay under the Premier plan. And as you can see here, the overall savings under the Premier plan is just over $850. Next slide, please. So VSP, we do offer a wide variety of options within our network. As a member, you can choose from either an independent private practice doctor to big box retailers such as Costco or VisionWorks, or even our online retail store, iconic.com. We do have over 96,000 network options nationally for our members to choose from. Next slide, please. And just a little bit more information on iconic.com. This is our online retail store where members can use their VSP benefits, and it's actually the only online retail space that member can access their benefits. Members can go on and upload their prescription, which is always double checked by the optometrist that Iconic has on staff. And you can go ahead and select your frames and lenses or contact lenses right from the website. Iconic.com does have a really fun virtual try-on tool where you can, upload a photo of your face, as well as they do facial scanning and virtually try on frames that you're selecting. And if you're dissatisfied for any reason, we do also offer free shipping and returns as well. Next slide, please. And I also wanted to take this opportunity to remind you of some of our extra discount programs that we offer alongside our benefits. Members do get an extra $20 on certain frame brands at the time of service if you happen to pick one of these frame brands. And the full list of qualified frame brands is available online at vsp.com. On iconic.com, members also do get an extra $20 on non-prescription sunglasses if you choose to purchase this through Iconic. And then we are continuing our partnership with True Hearing, which is a national network of audiologists. And as a VSP member, you get not only a discount on the hearing exams, but also up to 60% off the hearing aid devices. One of the things I wanted to mention also is with True Hearing, you as a VSP member are able to enroll as many family members as you'd like. So if you had a sibling or even a parent, uncles or aunts who needed hearing aids, you're able to enroll them into this discount program and they would have access to the same discounts as you would. Next slide, please. So once you're enrolled in either the basic or premier plan, you can create an account on vsp.com where you can check eligibility, check your benefits, and search for providers and much more. On vsp.com is also where you're going to be able to find all of those extra discount programs that I previously mentioned, as well as certain rebates on contact lenses. You can also call our customer care line at this 800 number listed here, 800-877-7195. If you needed a provider list in your area, or if you had any questions about your benefits. I do also want to mention that ID cards are not needed at our provider's office. However, beginning January 1st, SFHSS members will have the option of using a VSP assigned unique member ID rather than having to use the last four of your social. So you will be receiving a welcome letter in early January of next year with the member ID card with this unique ID number on there. If you lose track of this or for whatever reason need another copy of it, you can also obtain a card through our website, vsp.com again, and then just go ahead and print one out. Next slide, please. So this is just a sample of the ID cards that we will be sending out in January. Next slide, please. Also just wanted to remind you that if you do enroll into the Premier plan, your dependents, or if you're enrolling in any dependents into the plan, they must also enroll in the Premier plan. So your entire family must be enrolled in either the basic or Premier. Next slide, please. So as you know, your open enrollment does end at the end of the month, so please enroll in your VSP benefits before then. And if you have any questions, please feel free to contact us again at the 800-877-7195 number or visit our website at vsp.com. Thank you.
Thank you so much, Nancy. Great, and now we are at our Q&A session. First of all, I want to acknowledge that we are already over time, but if everyone has just a few more minutes, maybe until 6:45, I'd love to get to some of the questions where we did not get a chance to answer our participants yet. And if we are unable to answer your questions today, please know that we will be publishing answers to all of the questions that you asked today on our open enrollment webpage, and that's sfhss.org/OE 2021-FAQ, not /, so a -FAQ. And of course, our phone numbers is listed right there. So without further ado, I'd like to answer some of the questions that have not been answered yet. So one of them is, can we enroll in dependent flex outside of open enrollment period once we know the schools will reopen for in-person learning, for example, February or March? Would you take that, Rick? Is Rick still here? Rick Neward?
You may be on mute.
Oh, is he on mute? Well, in the interest of time, I just want to share that based on what he had shared previously, yes, you can. That I believe that qualifies as an event. So you can call and add money to your account then. I saw another question from Vince about, if you had already paid for services, if you can receive a credit as a result. That is something we encourage you to reach out to P&A admin, as I am not able to answer that. Oh, here's one for Delta Dental. If we have double coverage with Delta Dental PPO, does it cover all orthodontic expenses?
Hi, it's Sharon. I did put a response in the queue. However, just to give a quick synopsis, it most likely will not, due to the fact that orthodontic care is extremely expensive, especially if you're going Invisalign, which can increase that out-of-pocket cost. However, what we do recommend is twofold. One, finding a PPO orthodontist, and that can easily be found on our website by putting in your zip code and actually selecting the orthodontist provider, just that queue, and then it will pop up all of the different orthodontists that are PPO contracted. Or you can call our contact center and we can help you find an orthodontist in your area. The other item that we would recommend in this scenario is asking your orthodontists to submit a pre-estimate prior to starting that treatment or orthodontic care. That would give you then the cost, your out-of-pocket cost, what Delta Dental will cover, and also if you include kind of coordination of care, meaning that you have a second dentist or dental plan, we can estimate that for you as well.
Thank you so much, Sharon.
Yeah, you're welcome.
And now, since Rick is not here, we will get to those FSA questions, and he answered many of them. Some of them I think we know the answers to. In 2021, will OTC vitamins, aspirin purchases be allowed without a prescription from a doctor? Actually, a lot of OTC medication is allowed right now, and I believe with the CARES Act, it was retroactive to the beginning of January 2020. And you can check the FSA store online to see what is allowed for your FSA. Oh, what is the website and contact information to speak with a Delta Dental rep?
And I put that in the Q&A as well. Sorry, this is Sharon. However, let me just read those phone numbers off. The PPO contact center number is 888-335-8227. Or if you're enrolled in the Delta Care plan, that number is 800-422-4234.
Thank you, Sharon. And I also saw we have a question regarding commuter benefits. Commuter benefits are not actually with SFHSS. You will have to contact the commuter benefits administrator for that. And Matt, are you on the line? Can a pre-existing 457B with another broker be transferred to SFDCP traditional or Roth? If yes,
yes, it can. In fact, great question. So any old IRAs, 401ks, 403bs, 457bs, you are definitely encouraged to roll those over, and we have a rollover specialist that I can get you in touch with, and that's a free service that we can help you out with. And again, yep, no taxes, no penalties, and a couple of other nice features that allows you to borrow more if you want to take a loan against your 457B, and you could also probably see a nice reduction in your fee structure. So there's a lot of good reasons to roll over your money, and again, I'd be happy to help out with that.
Great. Well, thank you everyone so much. Thank you to our presenters, and thank you for all of the participants for your great questions. Again, all of your questions will be answered within a week. We will try to post all of the answers onto our website, sfhss.org/OE2021. And I know there were still some people who wanted to ask about vision. Please know that we will have contact information and links to all of our vendors on our website, and you're welcome to go directly to them to ask questions, or you can call our member services team. So thank you everyone, and have a wonderful evening.
Thank you.
Thanks.
Thanks, Jessica.